It's truly heartbreaking. Singaporeans spend a fortune on health screenings every year, only to find out they have late-stage cancer. In a country like Singapore, where our healthcare system is hailed as the best in Asia, why do such tragedies keep happening?
As a clinical doctor, every time I see a patient holding a thick stack of normal health screening reports, only to be diagnosed with mid to late stage cancer, my heart just sinks.
We spend hundreds or even thousands of dollars every year on health screenings. The reports clearly show that all indicators are normal. So how does cancer still manage to hide?
This is a fatal misconception. The annual health screenings that many do actually focus mainly on chronic disease indicators like blood sugar and blood pressure. They are absolutely not specialized cancer screenings. Early stage cancers such as lung and colon cancer almost never cause any abnormalities in routine blood tests. By the time you feel pain, it's often already at a late stage. Take prostate cancer, for example. Over 30% of patients are already at a late stage when diagnosed. Routine health screenings can never replace in-depth cancer screenings.
Since in-depth screening is so crucial, why are people still reluctant to do it? Data shows that the breast cancer screening rate for women aged 50 to 69 locally is only about 35%, which is quite low among developed countries.
There are psychological and practical pain points behind this. Many people have this ignorance is bliss mentality, thinking that finding out they are sick will only add a burden. But reality is cruel. Over the past 5 years, the number of young cancer patients under 40 inches Singapore has increased by a staggering 34%. Avoiding screenings is essentially gambling with your life with very low odds. Besides that, the reality of expensive medical care and long waits locally also deters many. Private hospitals are too expensive, and waiting for a specialist clinic at a public hospital can take months, causing many to miss the best window.
Faced with expensive medical care and long waits, what should ordinary people do?
Prevention is always cheaper and more effective than treatment. First, take advantage of the free screening subsidies from the government's Healthier SG initiative. Second, if you need in-depth specialist checks like endoscopies or low-dose spiral CT scans, don't put them off because of cost or queues. Nowadays, cross-border healthcare is very mature. Many patients choose to go to neighbouring countries like China. The equipment there is of top international standards, doctors are highly experienced, and the waiting time is short with much lower costs, perfectly addressing core concerns.
Finally, what do you want to say most to our Singaporean viewers?
Don't rely on regular checkups like it's some kind of lifesaver anymore. You can get tested locally or pick affordable cross-border healthcare, plus enjoy a short getaway and foreign culture. But most importantly, in-depth cancer screening has to be your top priority.
You just mentioned cross-border healthcare. Could you elaborate on its advantages?
Sure. Take China, for example. The equipment in the health screening centres of many top-tier hospitals is extremely advanced, sometimes even surpassing some private hospitals in Singapore. Moreover, Chinese doctors have massive clinical experience due to the huge number of patients they see daily, giving them high acuity in early disease detection and diagnosis. More importantly, the overall cost of cross-border healthcare is usually only half or even less than in Singapore, with almost no waiting time. For those who want in-depth screenings but worry about cost and time, it's an ideal choice.